This is the self adductor release. So for this, I'm going to be using a kettlebell. You can use a few different things. Anything that comes up and has like a nice little shelf here that you can set your leg on. You can also use a larger, like a softball or something like that. You probably could use a lacrosse ball. You need a little bit more hip mobility so that hip can get down to the ground so it can actually do the release for you. We're going to be using a kettlebell in this exercise. So get your kettlebell, get on the ground, and little tips for this. So you have some blood vessels and stuff that kind of run through close to the knee around the adductors here, or the groin muscles that go down the side of the leg. So we're going to stay away from closer to the knee on the inside. So to be safe, let's work on the top 2/3. So anywhere from the hip crease down to the last 1/3 of your knee we're going to avoid. Okay. So for this one, let's go ahead and go up to about halfway, or a little below halfway, up the femur there. We're going to get this kettlebell and put it perpendicular to the leg. So in this position, I can already feel that that's on a nice tight spot. And when I get here, you can hold the kettlebell and kind of rub back and forth like this, kind of matching that adductor. We also call this the adductor smash, which is appropriately named. Well, another thing you can do is extend the knee and then flex the knee. So you're using part of your adductors to do that as well. And then another thing you can do is lift that leg off the ground and drop it. So on this one, we're kind of massaging across the fibers of those adductors. So after you get done with all 3 of those, maybe 5 to 10 reps of each, you're going to move a little bit farther up, about halfway between like that 1/3 point up in the hip joint there. And you're going to do the same things. You can massage back and forth, extend the knee, flex the knee, lift that foot off, drop it back, and then move up one more. This is up closer to the joint, and do the same 3 things. Massage, extend the knee, flex it, lift that foot off, and then drop it back down. Okay? So I would spend 1 to 2 minutes on each side on this one to get good work in.